That's my own necessary action.
All right. So today we're gonna do assessment. Is there any assessment questions you guys have? We're not gonna do the process, like how to do an intake per se, but this is part of it, but we're gonna actually start with what we call physical assessment. The nails, the eyes, the hair, the ears, all those things. We talked about little bits and pieces of them, but we're gonna put it all together. And then the tongue itself, and then eventually the pulse. Or if I have a whole class on just the tongue, a whole class or two on just the pulse. So, questions at all on physical assessment, like things you really want to know about? Anything? What's that?
I want everything. Yeah.
Everything, right? That file's okay.
How reliable is the physical assessment? Like, how much do you bank on that versus like other assessment techniques?
So in general, the physical assessment skills are pretty amazing. They're pretty reliable. They're extremely important. So patient symptoms are a huge part of everything, and their medical diagnoses are a big part of everything. But really, physical assessments where you're really going to refine everything, where you're going to double check yourself. I like to do it at the end because I kind of have an idea what I'm thinking. And then when I get to that point, it's like, oh, I didn't see that. I was not expecting this. I was expecting this. This all looks pretty, this all makes sense, or this doesn't make sense, or things are conflicting. The bigger question always gets once you do assessment is that what if you see all kinds of different things, which is common in America in the time we live in, because people are so physically, emotionally messed up, right? I mean, truly. So, I think maybe in ancient days, people had like one imbalance, and we've seen, from talking in class that people often have, their kidney has something, their liver, their lung, like that's like everything and all kinds of things. So really the question becomes is like with assessment is what weight do we give all those things, right? Like what weight do we put on what the doctors diagnosed versus what we're assessing, what weight do we put on what their goals are, and how does that relate to the assessment? How do we rectify complete opposite problems going on? Because often the physical assessment will show us things that regular symptoms may or may not have shown us. And we have to deal with it.
So if you come across a symptom that you find or an issue you find in a physical assessment, and it was not a symptom that they had mentioned, but it's a large issue, do you just treat it anyway and say, hey, you have some liver problems? Or do you just treat it and not tell them?
Yeah, I mean, usually I like to enlighten people without scaring them or getting them over concerned. Or ease their mind, right? Tell them, hey, this doesn't look so bad. So I like to be kind of honest with that. Sugarcoat bad news and probably overemphasize really good news. So, but yeah, it's just it's a challenge because people have so many things. Prescription medications are going to obscure maybe how the tongue looks or how the pulse looks. But a lot of the other symptoms are going to be pretty reliable. The main thing I would want to emphasize is your eyes and ears and fingers are never going to be the same. once you see this in people, right? You can't not see it, right? You can't not look at Time magazine and see someone sticking out their tongue and go, oh. So. It's a good thing, to me, like, it's a really cool thing. But it's also like just something you have to be aware of, that you're always just gonna see stuff, and you should try to, like, that's really fun. You know, when you're first starting out, you know, you should just look at everybody's pulse and fingernails and eyes and ears and just get as much experience as you can. Like a lot of this I found out myself by just what we call working backwards, right? I knew somebody was just in the hospital with like kidney disease, or was in the hospital with a stroke, and then I challenged myself to go look at their eyes and ears and tongue and pulse and find out, like, where's that at? Because it should be there, right? So the cool thing is that the body never lies, right? Even though as humans we think we hide everything, and we can hide our lives, our problems, our emotions, our physical problems, it all is showing everywhere. So from our posture to everything. So that's a good reminder, right? Physically and just psychologically, like everything is known, everything is showing to the world. So that's what, right? The biggest problem is that when we were growing up, nobody gave us the guidebook for interpreting it all. So one of the cool things about physical assessment is that you're getting the guidebook. This is what we all should have gotten when we were like in junior high, to understand our bodies and everybody around us and everything. So it really is like a guidebook. So I think it really applies to people that even aren't into natural medicine per se, just good for health monitoring, right? The good thing is a lot of these physical indicators we can watch ourselves. It's hard to take our own pulse, but the rest of these we can kind of do on ourselves pretty easy. Also, the pulse is just a little bit more tricky. Yeah.
So you said prescription meds can obscure the pulse and tongue reading, but not the eyes, the ears, and the nails.
Not as much, yeah, not in like not in a real specific sense. Okay. Okay. I feel like I want to give some wisdom here. Eli Jones had all these different quotes about being a master diagnosis here. Okay, ready for this? This is some Eli Jones, who I think is probably the greatest herbal doctor that's ever lived in America, maybe American soil. So this is one of his quotes. The hand is the most delicate instrument for diagnosis that can be conceived by the mind of men when it has been educated to have his eyes at his fingers' ends. They were talking about pulse assessment, right? A doctor should have just as sensitive hands as a blind person. I always impress the idea upon my students that the very first thing a doctor must learn is to read the pulse. Not one doctor in 1,000 can do it. So it's relating more to pulse, but throughout history, there's been this idea that pulse diagnosis is very elusive and tricky, and not really. It's really not that elusive. It's very elusive to get to a super high level of it, but just learn the basics. It's not that super challenging. The only challenge with it is you just have to have experience, because you can't read about a pulse, you have to actually just feel it. So that's kind of like the biggest challenge with the pulse. The rest of all this is pretty easy to learn. So just the pulse is the hard part, right? There's a good one on the pulse too. A child can count the pulse, but it is the doctor's business to read it. What we know what we want to know is the character and the quality of the pulse. Here he's talking about, we don't care about the pulse rate. I mean, we do care about it, but we're looking for the qualities of the pulse, right? Okay, so the assumption that we're operating from, or the principle, is that remember we said every internal organ has a way it communicates with the outside world. So that's part of how we arrive at all these assessment ideas. That every organ, when the liver has problems, it's going to show up where? Your eyes, right? Your fingernails, your sinews, your tendons, ligaments, cartilage, connective tissue, right? When the kidneys have problems, it's going to show up where? Your ears, your hair, your bones, your joints, right? These are all why we spent so much time getting into theory. So a lot of this is just common sense, which how the organs communicate to the outside world. Okay. Okay, there's all kinds of quotes, but let's just kind of get into it here. Where are we going to start? We'll start with the nails, fingernails. Let's start with the fingernail. This is so easy, that's why. What do we know about the fingernails first? If people have nail polish and shellac and all those things, will that like make this not very effective? Right, that's going to kind of maybe ruin the effectiveness of it with all these modern things, okay? And even if people have them removed, often, the nail can be so destroyed by fake nails or not. Okay, so what controls the nails, first of all? Remember? Liver controls the fingernails. So that's one of the main principles that we're looking at. So in general, we're basically looking at the health of the liver in general. That's like a really important point to remember. Color. When we look at the nails, we're always going to be looking at color. What do we mean by color? What's going to show up in the color of the nail?
If they're pink or if they're white or if they've got the little moon things.
Okay, let's just go into color. So we're talking about white color. We're talking about blue. Talking about purple, yellow. Okay. So what we mean when we're talking about the nail is really kind of talking about the fingertip as a whole, right? So if we look at somebody's fingernails, one of the first things we do is we're going to press them and look at like how called capillary refill is, right? I'm going to squeeze the nail and we're going to see how quick circulation and blood flow comes back, right? So if we squeeze the fingernail or the nail or the nail tips look really white, what is that? That is a lack of blood flow, right? Or it's also very common in weak blood, like blood deficiency or anemia might be an extreme, right? So with anemia, the nails are really pale, right? Because the whole body's pale, right? So the nails are also going to be the same, and the fingertips are going to be the same, and the whole fingers are going to be the same, right? So when we press the nail and they're white and they don't rebound to this pinkish nice color right away, or people that have poor circulation, right, have Raynaud's, their fingertips are going to be often white because there's no blood flow. So either there's no blood flow and they're pale, or there's weak blood and they're pale. That's a general idea. Anybody have like really prone to anemia and blood deficiency? Class, how's your nail? Are they pretty pale or not? Yeah. What can come up for a second? want everybody to see all these things. Once you see some of this, it's so easy to spot. Okay, so we got blood deficiency, we have circulation. Okay. Let's see. Yeah, so she's not too bad, but. So when you squeeze her nail. Especially this one's a good example. It stays white for a while. And the nails themselves are white, but it's not super bad. It's not that bad. She's also got, oh, good, she's got liver thumb. This is called liver thumb too. We'll talk about that. We'll talk about the shape of the fingers and nails. Can we see that again? This is liver thumb. When you see this, you know this is a good person right away, or has a genetics of like a liver challenge. Really common with MTHFR too. You have MTHFR? Okay, but she has MTHFR, so this is what we call a liver thumb. Anytime you see this, you know
What makes it
people,
liver?
how it looks almost kind of hammer-like,
Like flat.
not a normal shape, how it kind of comes out, and sometimes it's called a hammer. But this is, hers is not super extreme, but it's different than an ordinary thumb. This is instant liver indicator, means we have to watch the liver for her whole life.
So it comes in, and then at the last week out of your soul.
Mhm. It's very mild, but it's not a normal thin thumb like this. It actually hammers out. Almost like mushrooms out. See that?
So it's not the joint that's swollen there necessarily.
Medical attention wise.
Yeah, some of it is how the joint is structured with it, but it can get really pronounced. This is like very mild version. So she has like a mild liver tendency. Okay, and the nail bed just looks different too. I'll let you all look at it. So when we press her hands, she's got pretty good like capillary rebound, but when we press the tips, they stay white quite a bit. And when we press, and she's also got, when we look at her hand, slight yellow skin color. You notice that? What's yellow gonna be?
Liver.
Well, yeah, she's not jaundice, but it's liver, right? It's liver, but it could be more severe. So I'm gonna have you walk around. And let everybody just touch your, you okay with that? Let everybody touch your fingernail and see that. And to see the tone of her hand is slightly yellow. And then look at what we call liver thumb. Okay. I don't like the word hammer thumb, because it just doesn't sound nice. But this is very mild. Okay. Want to show everybody that? So we have color, okay? So here we're talking about the nails, but we're also talking about just the fingers and the hands in general too. So when we see pale, like her pointer finger has that really, press her pointer finger, you'll see it's pale. It's not extreme, but when you press it, it just kind of stays pale for a while. It should, when you press, it should, your fingers should turn pink immediately, or your hands should turn pink like immediately. Okay,
If you have one liver thumb, do you have two? Or can you just have one?
you can just have one, but most people have two. What is your other one like? Okay. Okay, so here we're talking about colors. I don't want to get into shapes yet, but we just came up, so everybody gets to see it. Okay. What if when we press the fingertips or we look at them or we press the nail, we already notice they're bluish. What does bluish mean? Blue is really easy, right? That is a lack of blood flow or poor circulation. But what does it mean hot or cold?
Cold.
Blue is always poor circulation with cold. Somebody take really good notes of this for me? Okay. So blue is Rach, we have more markers than
Thank you.
So for blue, we've got. We have poor circulation plus cold. What is purple gonna be? So when we look at the nails, we look at the fingertips, even the hands sometimes. I have that a little bit right now, purplish. It's like a cone of purple. Not pronounced, but just like a slight cone. What does purple mean? The opposite of blue. So it's poor circulation with heat. The purple and blue are kind of opposites, so we have. There we go. Let's
got
get
it.
rid of all these here. Okay. So we have poor circulation with heat. Okay. So again, remember, once you know the principle, this is the same everywhere, right? If your eyes look that way around it, it's the same thing. If your tongue looks that way, this is the same color things we see everywhere, right? If the tongue is yellow, we know it's the liver, right? So. Okay, what if the fingers look yellow? So she has some yellowish of like her hands and fingers. But what we can also see is the more yellow the nails get, the more the liver is involved, right? So yellow is always a liver indicator. Sometimes the pancreas, but the liver especially. So as like with alcoholics or people that are doing like liver toxic lifestyles or medications, we can watch the nails get more and more yellow. Okay. Okay, does that make sense? Colors, would we see any other colors? Probably not, right? So this is in general just the color pattern to the nail. Okay. Everybody's okay with that? Okay. So we can also talk about with the fingernail moisture. What the heck does that mean? Means do the nails, I actually have pretty good nails moisturized. Do the nails look really just healthy in general? Or are they really dried up and all like kind of shriveled? You know what I mean? So
If somebody's nails like, go like, you can sort of peel back on the nails. You know, is that like calcium? Is that-
that's more of a texture thing. Yeah, that's, we'll talk about that in a sec. So, here we're talking about moisture, meaning the nail should just look really healthy and shiny. Again, some people will buff their nails and make them look really better than they are. But the more dry the nail gets, the more like ridging and shriveling we see. Right, it's gonna look rougher, it's gonna look shriveled. Does anybody have really dry nails or like a lot of cracks and ridging? So the more dry the nail gets, right, the more like cracks going this way we're gonna see. We're gonna see like atrophy, like the nails start to even shrink up. Okay.
Are ridges the same as lines?
Can I see everybody's nails real quick? Let's just. It's anything. Oh, yeah. Really dramatic.
Think about that. Yes, it's my next thing. For that.
Okay, so. You ever want to see a Bata hand of all Bata hands? This is a Bata hand, by the way. Bata people have really long, thin, skinny nail fingers. When you see fingers like this, you just know it's a Bata person. The Bata have very thin, long, to skinny nails. It's very. Wow. Nails are doing fairly good, and yet they're really. So. Let's see here.
Teresa feels neglected too.
Yeah, this, you should do this.
So in general, the more dry the constitution gets, the more cracking and ridging and dryness the nails are gonna have, right? But again, sometimes people buff their nails and do all kinds of stuff. They're buffing the ridges out, so we do want to ask about that. Okay,
So what do the ridges mean?
so we're gonna do that now.
Oh, okay.
Sorry, I thought I missed it. What are we gonna call this? Texture, the texture of the nail. So the main thing that we're gonna see with the texture of the nail are cracks and ridges. Okay. And in general, we're gonna see a couple of things happen. Oh, we forgot one basic piece of information that's really vital. Okay, so this is your nail, right? This is the most important piece I forgot to tell you. This is not in any book. This is just something I figured out myself. So the bottom of your nail is 0 right now, where you're at right now. The middle of the nail is exactly 1 year of issues. The top of the nail is 2 years. So the nail in general shows only 2 years of stuff, right? 2 years of experience. You can have problems that are so dramatic from the past that they never grow out of the nail. You know what I mean? Like somebody could have had chemotherapy 10 years ago. And when we look at their nail today, they still have these ridges going like this and this. That's like a bad sign, right? That the body has never recuperated from that. So within 2 years, your nails should be totally different. Okay. Okay, so everybody's okay with this? So when we see these issues, we're gonna be able to tell when and where they happen, okay? Does that make sense? 2 years. This is just the fingernail itself, not the finger, right? Just the fingernail. Okay,
And in your drawing, the cuticle is the 0?
yeah, the very bottom of the cuticle would be ground 0. Yeah. So this would be right about 6 months. Right, this would be 1.5 years. This is like extremely accurate too. You can just look at when women have babies and all this stuff. You can see this really, really well. Okay. Everybody's okay with that basic fact? Good. Okay. Okay. So when we talk about the texture of the nail, there's only really a couple major things we're going to see when we start to do nail assessment. Number one is we're going to see vertical ridges. What do vertical ridges mean? I guess the first question is, how serious are vertical ridges? It's like minor, right? We don't get as concerned. They're not as serious. They're common, but they're still showing something's going on, right? So in general, when we look at our nails, vertical ridges are going to mean liver, right? Sometimes it's going to mean circulation. And sometimes it's going to mean hormone. But it's almost always liver or circulation. So the worse your circulation gets, the more ridging you'll get. So then obviously if somebody comes to see us and their nails are like purplish or bluish. And they have ridging, that starts to like show us again, like those are like two circulation indicators, right? So it's. You know, the more little check marks we have in an area, the more emphasis we want to look at that, right?
Does it matter, like finger to finger? Like I have some ridges that are more defined in one finger than another.
I will show you a secret finger code.
Great.
I'm not supposed to, but I will. Okay. So in general, ridges going this way are liver or circulation, sometimes hormone. But here's what happens though. The progression of this is how wide or how deep the ridges are shows you how severe it is too. So you can just have like a couple ridges, and often people just have like a little ridge or two, right? And then it starts to progress to something like this. And then eventually it can be, you know, like huge grooves. Or just the nail is really getting deformed, right? So this shows you intensity and extremeness of how bad that is. So obviously this nail is better than this nail. This is worse. We have more ridges, right? So the liver or the circulation problems are getting more intense, or they've been going on for longer, right? When we get to something like this really starts to pique our interest. So this would be more really deep problems with the liver. For sure, a lot of people that have like hepatitis or liver cirrhosis, they're gonna have nails like this, and they're probably gonna be yellowish too, right? The nail. So the nail itself will turn yellow as the liver starts to get really bad. Not just the color of the skin, but the nail will start to get really yellow too. Okay. So sometimes hormones, but almost always liver or circulation. Okay. It's normal to have like a little bit of a ridge, but you don't want like a lot, right? Okay. What could be wrong with the liver? Could be liver disease. It could be stress from drugs or medications, right? It could be just liver imbalance, digestive imbalance, could be gallbladder. I mean, so it could be a lot of things, right? It still doesn't tell us exactly what's going on. It's just pointing to what is going on inside. Where's the major problem at, right? Okay. So everybody's okay with that ridging? Anybody have a really good ridged nail going up and down? Oh, just that's not too bad though. That's not too bad.
Right on there.
Yeah, that's a good one. You want to show everybody your thumb? Mike's gonna show everybody his thumb. He's like maybe starting to get some more ridges. So let's all look at that. It's really easy to spot. This stuff is like face and eyes and ears and nails are like really simple, right? You can just see this stuff. Once you see it, you'll always see it. Yeah. Okay. Okay. What about the other direction? Oh, yeah, you want a picture?
Yeah, sorry.
I'm gonna redraw this.
Okay.
Let's see.
There you go.
Thank you.
That's the progression. So what I'm not meaning that it's darker colored, right? Just that the ridges are getting wider, they're getting like even more pronounced. So that ridge thumb, by the way, is like on 1 to 10. Mike's is like 2. I mean, things can get really bad with people. So because of all that work he's did. right? All that health,
Yeah.
vitality.
Let's see, Mike.
So, everybody's okay with that? You got a picture of it? What do you got a
Okay, you
picture
wanna
of
do
it?
the thumbs up?
Yeah,
can.
got it, thank you.
Make ready,
Okay, now we're gonna go the
Whoa.
other direction.
It's not focusing.
cause you gotta move it in front of Nicholas.
Run it, Nick.
There we go.
Okay. What if we get ridges going this way?
Oh, yeah.
Oh, wait, stop. Don't do that yet. I forgot one thing. So there is what we call central ridge. So every now and then we see this, okay? So you can have what we call, and this is even like in medical textbooks even, it's called the central ridge. It looks almost like somebody took, it looks weird. I'll show you, how easy is this to see? It's really easy to see. It jumps out really fast. Let's get a picture of it here. It's called central ridge nail. Even shows up on Mayo Clinic. Okay. If I can blow this picture up for everybody. But this is not very bad, by the way, okay? This is a central ridge. This is not bad. This is like the beginning of it. It looks like somebody took like a knife or like cut out part of the middle, but it can get to be where like it looks like somebody like chainsaw the middle out. Like it can be really severe. This is called central. This is in medical textbooks too. This is not just a natural medicine insight.
So it's a dip in, it's not a.
It's like it looks like a cut, yeah. And it can get where almost like half the nail looks like somebody like just split it in half with like a chainsaw. But this is like just how it starts. Okay, what does this mean when we see a central ridge? This is like the blood flow somewhere in the body is so blocked that this starts to happen. So this is a indicator of severe heart disease or severe blood vessel disease. In fact, this actually, if you find people that have had a heart attack recently, they usually have this. It could be on any finger, but it's usually the thumb, but it could be on any finger. So when we do see this, we do want the person to know that this is a very powerful sign of either the heart has a blockage or the blood vessels have a blockage, or maybe they've already had like stents and ablations and heart attack or surgery, open heart surgery. If you see somebody that just recently had open heart surgery, they'll have this on one of their fingers.
Does that take 2 years to clear off then,
Uh,
off the nail, or
It takes quite a while though when it gets that.
do all things take the full 2 years to clear up from the nail?
Most things take at least a couple of years to clear up. Something like your color can get better pretty quick, but a lot of these like grooves and things can take a while. Yeah. Okay,
Is that painful? Like, does it
Nope.
affect the blood,
Nope.
tissue underneath?
no pain. A lot of people think, like a lot of younger doctors think it's like a fungus or so. It's a medical thing. Right? So
How about liver, his thumb, is that ever gonna change shape, or is that always? Like her thumb?
the
is that
thumb
always
will
gonna be
not change shape. Yeah,
Okay.
yeah. So the liver thumb, the thumb will not change shape.
Even for livers?
Even for those better, yeah, it's already like grown out, yeah. Okay. Okay. So that's called the central ridge. Okay, so now we're talking about. Horizontal grooves. What are horizontal grooves? Horizontal grooves are, what's that? Major stress on the body, yeah, in general. Major stress, that stress could be anything, right? Like after women have a hysterectomy often, they'll have like a big groove or a pregnancy. Or if there's been like a major serious viral infection, or you've been hospitalized. Or you just got like a horrible divorce or something, right? So at first it just starts as like a little line, and the line is again gonna tell us exactly how long ago it was. Right? 6 months, so this would be, you know, about probably 6 months ago, right? Because this would be, this middle point would be 1 year, right? So there we're about at 6 months. Sometimes we could have multiple, but usually what happens is it progresses where this groove gets deeper and deeper and more intense. Okay. This website I just found has got them come with their pictures.
So do fingernails read like toenails, or toenails a whole different ballgame?
Toenails don't count. Yeah, just because of how circulation is and different problems.
What's the website that you're on? Can you share that?
I will try to, yeah, I'll share this later. I was looking for this. It's got a lot of pretty decent stuff. Who did this? Okay, it's not giving me what I want, but in general, this is really easy to see. This is often like a big hormonal adrenal issue. Could be an emotional stress, could be an immune stress, but it's a stress. And we want them to grow out, right? It should kind of grow out. But sometimes as people heal, this will actually go away before like it grows out. So like that ridge will start to get less kind of like grooved or like less bumpy. And the deeper the groove, the more intense it is. And the wider it is, the more intense it is. Okay. So it's also very easy to spot. These are not super common. I mean, they're common-ish, but they're not like as common as vertical ridges. Okay. Surgery, like post-surgery, people often have this. Radiation chemotherapy always does this. You can tell, you know, people have had that. So sometimes it's normal from the sense of it explains when somebody had a surgery or radiation or something. But when we see them in someone we don't expect, we have to just figure out what that was, what did that. But this is often a sign of like also extreme adrenal fatigue. That's like a extreme, like you had an extreme event that really depleted the adrenals, like you didn't sleep for like months or something. Okay, very easy to spot, but in general, this represents a major stress to the body and like a depletion of chi, you know, something really affected your vitality and energy or your hormones, or it doesn't necessarily refer to any organ itself. In my experience, it just shows an extreme stress on the body. Okay, so it should grow out too, right? As people get better, this should grow out. Okay, that one's pretty easy, right? That's easy to spot too. Okay.
So like if we were at war, would you say that on all of the soldiers' nails?
Probably a lot of them would have it when they come back, right?
Okay.
It would, yeah, once they got back, like 6 months later, it would show up there probably, yeah. Yeah. Absolutely sure, yeah. If we saw prisoner of war, would definitely have that, right? Or something extreme like that. Okay. Okay. Everybody's moving along good so far? Do we want to see grooves like that in young people's nails? We don't. Young people should not have that. A young person's nails should be like perfect, like a baby's nail. If you want to look at a really good nail, look at a baby's nail. So it's really, really perfect, right? Okay. Next one is just what we call the luna. The moons of the nail that should normally be here, okay? This is another one of the so easy to tell what's going on things, okay? So this Luna is directly going to tell you how strong the kidneys and adrenals are. It's absolutely super accurate. Almost all the time. This will not change though until all their energy and vitality have came back. So it's very slow for it to get better, right? Like if you have extreme adrenal fatigue or extreme fatigue and you have 0 Luna, that would be like the most depleted. So it'll just look like this. There's just nothing. We're talking about the whites on your nail, right? You should have a normal half moon, right? It should look like a moon, part of the moon, right? So this would be like, complete adrenal fatigue. So it's normal for like your pinkies to not have like much of one because there's so little, but especially like the first 3 and 4 nails, you should have really good Luna. Okay, so this is like a so easy way to tell how people's adrenal or hormone health is. So when women have like 0 hormones, like estrogen and progesterone have crashed, and adrenals have crashed, the nails will look like this. Okay. Okay. Remember, extremes of either kind are never good, right? So every now and then we'll see this. Like crazy big Luna. So the white patch goes like all the way up like halfway through the nail. What do you think that is? That's not good either, right? I forget, there's a medical name for it. I forget what it is. This means the opposite, like usually this means hyperthyroid or some part of your body or hormonal system is in hyper overdrive. Maybe your hypothalamus or ovaries or it's some kind of a major excessive hormone. You see this, I see this most commonly in like people that are hyperthyroid and they're not diagnosed. But we could see this like sometimes PCOS will do this because there's such excessive amounts of hormones, the polycystic ovarian syndrome. So we don't like to see that. It's not as common, but this is a really good guy. As people's energy comes back, a couple of months later, the Luna will start to respawn and start to get bigger. So it's a really good long-term guide if people are making like progress with adrenals and hormones. Okay. This has nothing to do, a lot of clients go, oh, well, my cuticles, I don't peel them back like I'm supposed to. You can't like hide this or peel this back. It's just like either they're there or they're not there. So this has nothing to do with like nail salon, right? Okay. So in general, this is the kidney also. So it can show stress with the kidney or the adrenals and hormones. Yeah.
Can that be congenital? Like, I have never had that since I was a kid, and I always noticed that mine were different than everybody else's, but I mean, I was young when.
Yes, I mean, like when children should have these.
Yeah.
So like when children don't have this, what does it tell us? Or when people don't have them in like younger ages, they're probably just because of what was going on with mom and dad, probably like this prone to like we're kind of born with weaker kidneys and adrenals. Or Jane, right? It's also like a measure of Jane. So yeah. So kids should like normal like children and that should have really, really decent, fairly healthy food. Yeah.
Should they be the same in both hands? Not.
They don't necessarily have to be exactly the same.
What did you say about Jamie?
So this could also be like a sign that the Jing is low too. Yeah, which is very tied in with the adrenals, right? Okay. Everybody's okay with this? Okay. All right. Okay. Now, occasionally we're going to see these little things, right? You're gonna see little white spots. These are fairly common. I saw some when we were walking around class here. They're not like severe. They don't look severely bad. They just, people get these little white spots. What does that mean?
I crunched my hand between two weights.
It could be from trauma, right?
Zinc or magnesium deficiency.
So sometimes it could be a zinc or mineral deficiency. Yeah, that's like a clinical explanation. So when we see little white spots on the nail, zinc or just other minerals in general. What else? What is white? Remember the color that reflexes the white? What's that? It's lung. So this is often more the pair of the lung, which is the colon. So this is more common a colon issue when we see a digestive colon issue. And to me, like, it's when people say it's a zinc deficiency, it's possible for sure. But to me, it's more that the intestines are not absorbing zinc. So yes, there is a zinc deficiency and we want to correct it. But probably the bigger problem is more that the intestines are somehow irritated or malabsorption. These are really common to food allergies. They're really common to people that have bowel diseases like Crohn's and colitis and diarrhea and constipation and that. So they're not like super concerning, but they always point to colon health. Guess what? Right where we see them shows like when the major stress was in that area. Like you could have like severe food allergies and do really good and never eat those things, and then just go on a bender or something for a week. And you know, if it was about like 6 months ago, it's going to show up at like the 6-month mark. Or you could have had like diarrhea from like food infection, right? Like this would be like about a year ago, right? They're gonna read that way. It's very accurate. It's very, very cool. So, or you could have been under like maybe stress, you had a surgery and your zinc maybe got super depleted. But to me, it's more the intestines are not allowing you to absorb zinc. So we can give people zinc, but we always want to remember that we also want to treat the intestines when we see this. They're not like a super bad sign. Really common to food allergies. If someone's gut's getting better, this is like something we want to look at. Say you've seen someone for like 6 months or so, and their gut's healing. We should not see a white spot down here at 3 months, right? Someone's been treated for a half a year, they're feeling better, they're getting better. If we see a white spot pop up, that means something's still, even though they're getting better, something's still not right. So this gets back to like the original question this morning, like this is how physical assessment's really cool, because it can be, even when people are getting better, we can tell when something's still not like completely right. Or vice versa, people feel really crappy, right? But all their lunar are coming back. It's like, well, that's interesting because your body is showing that your adrenals are restoring. Why are you not feeling more energy and vitality? That makes sense? Yeah. So this physical assessment is how we start to get to the great skill of all, which is prognosis, right? How to determine how quickly or slowly people are going to heal and what's it going to be like. Okay. Okay. All right. Feel like there's something else that I missed with the nail. Oh, okay. Now we're going to get into more shapes too. So sometimes the nail is going to have an appearance of peeling. What does peeling mean? Or like parts of the layers are kind of like peeling off.
It means dry.
It could be because it's really dry. But that is a more extreme, like peeling is a more extreme liver or digestive issue. And it could also be from malnutrition, like general malnutrition across the board. Or maybe we would better say it that the digestive problems they're having are creating a lot of malabsorption. So the nail, yeah, little parts will peel off, like almost like the top part peels off.
Like, what if that's happening in a child?
That's happening in a child. It's usually there's some digestive issues that are not addressed, or maybe there's like a hidden food allergy that's really affecting their gut. Or something's going on there that's causing malnutrition, but there could also just be multiple vitamin mineral deficiencies. Yeah. Okay, next one is, this one's really easy to see. We're looking at the nail from the side. This is called the hooked nail. So some people have at the bottom of their nails, it curves over, it hooks down. It's really easy to see when you look at it from the side. The normal nail should just kind of go out, right? But a hook nail, the nail actually kind of hooks and hugs the shape of the finger. So like this would be like the end of your finger right here. And the nail just like it hooks, it's very easy to spot. Thought I saw a hooked nail in class. Oh, here we go. Good job, I'm saying. Here we go. Here's a picture of a hooked nail. Notice this patient has a really yellow nail. I don't know what site this is, but it's pretty good. Okay. Okay. Hooked nail, really easy to spot. First of all, when we see this, we know instantly pitta person, by the way. This is an Ayurvedic nail diagnosis. This is the pitta trait. But we also know that it is a liver imbalance. You see the picture in the paper, the person's nails are really yellow. Right? So, what's that? Oh. So this nail curvature, hook nail, is a sign of either a liver constitution or just a liver imbalance or a pitta imbalance. Okay. There's something about the nail. Really. Looking at my nail notes. Okay, the fingers themselves, are you ready for this? There's two different schools of thought. Have to really think about this. Give you both schools. There's your thumb, right?
I've never seen it.
Yeah. Major. Okay, I have to think about this. I have to do this on my body. So pinky is going to be two possibilities. The commonly accepted one is small intestine. But the really fascinating one is it's your kidney bladder. That to me is more accurate and more old school. So in general, like when we're looking at the nails, right? And if only one nail has these problems, we ask why. And this is why. This is the guy. One nail is having more of a problem because this is the organ that's weak. Okay. Okay, this finger, I have to do this by deduction.
Right.
So your pointer finger is your A lot of people say your large intestine. But to me, the more accurate is your liver, gallbladder. Yeah. Okay. Okay, you want to know how you can tell this? Know the test? Take your fingers. Take your pointer fingers. Do this. And tell me if you don't feel that in your liver. Yeah. Right, liver, right? You can go like this and you can take your pinky fingers, do this. And feel this in your kidneys and bladder, right? So that's how you always self-check yourself. This is like actually like an old, this comes from this wisdom comes from like old Chinese medicine where this is like daily exercises you do to like stimulate your fingers and your organs. It's like an energy work kind of to wake your body up early morning. Okay. Okay, so your naughty finger, right? I didn't draw these right. Naughty finger, most people would say is your pericardium. And heart, we're gonna say it's your heart is to me the more. So that one they kind of correlate together. You can do it yourself, right? Want to do something? You want to know something really cool? That's pretty intimate. You take these two fingers, right? Put them right above your heart. This is how you can like move the energy of your heart. Use the same fingers. Take your pointer fingers, put over your liver, right? Spin that thing. This is like also like an old type of like this kind of self energy body work that you would do every day. Right? You do to your bladder and kidneys. Okay, and the last one is. I just know it as your large intestine. Yeah, that's the whatever it is, the fourth finger. If you don't believe it, just try it, right?
So large intestine is two? No, small intestine.
No, because there's an ally on the
Okay, there's
index
Some
too.
pointer.
Okay, the ring finger.
Those are both.
But that's the energy meridian, that's the index finger.
Yeah, so this is the fourth finger is, to me, it's lung, large intestine.
Then what's is that lung, liver, gallbladder on the index finger?
The index finger is large intestine. Liver, so these are two different schools of thought, right? Some people say liver, some people say large intestine, I say liver, gallbladder. So. Yeah. So I don't want to confuse you, I'm just letting you know, in case you ever read a book on it, so I'm gonna circle. I'm just gonna take away this other word.
The thumbs don't mean anything.
Oh, no. Thumbs are the spleen and stomach. Other schools will say the lungs, but you can just test it by doing this, right? So I was trying to show you that there's two different camps, right? Two different schools of thought, but I'll just show you the one that's me, the more ancient, and me as the least correlated better. So this is also like, okay, you hit your nail with a hammer, right? Remember the Constitution. This is where it starts to get really crazy, right? The Constitution is always trying to do its thing. It's alive, right? So why did you hit that? Why did you hit your thumb, right? Why do you cut yourself on one finger? What are you bleeding out, right? So like all these injuries and things like that seem random, they're not random at all. They're all triggered by our Constitution and our deep self trying to stimulate these organ systems. Like, you know, you always get stung by a bee on like an acupuncture point, right? Like what point is that? Why that point? out of like hundreds of points, why did the bee sting you on that gallbladder point, right? So this is also a really cool way we can use assessment, like if your kid cuts their finger, you're like, oh, okay. I get it, I get it. Or they smash a finger, right? So. Okay, everybody's okay with that? This is secret code. Questions? I didn't want to confuse people, but I just wanted you to be aware there's different schools of thought, different books will have different things.
I've read somewhere once that diatomaceous earth can help take away the ridges in your fingernails. Is that true? And is that something you want to do, or do you just want to like look for this treatment?
Yeah, I'm not a big fan of diatomaceous earth. But I mean, if it has an effect on like the gut, I mean that the ridges would go away because of that. But I'm not like a huge fan of it. You're better off doing fiber or trifalva or stuff like that, right? Okay. Questions on that? So this is our simplified version. Okay. Everybody's good? Okay. Okay. Okay, what are we going to next? The ear? So in general, the ear is this. This is the body, right? This is the head. And this is the thing. So this is, if we get real specific, this is like in Chinese, like in acupuncture, where you do like ear diagnosis. Little dots, little grooves, little bumps, little pimples, little sores, little indicators, little redder areas will kind of tell you what part of the ear it relates to. There's more, I mean, I can show you like an ear chart, right? This is another way we could do this. I'm gonna leave this website open and share that with people. ECM ear. I don't know if everybody's seen this, or I'm just assuming everybody's seen this, so we're going to. Everybody's seen the ear charts? Do you know what I'm talking about?
I didn't know she was with Coke.
Let me find this. Planning on that.
She gets nice.
More of a chart there.
I don't know.
Okay. Found one. I'm just gonna go get my chart. That's easier. Let me grab it. There we go. Ta-da. So this is the map of like all the organs. I'll send you some. So all the organs are in. So like if you get acupuncture on your ear, this is kind of the charts. There's different variations of it. This is a really, really old one. So you can see the eyes, like in general, though, it's the shape of the body. It all makes sense, right? It all correlates. So when you do ear seeding, like when you stick ear seeds in your ear or get acupuncture, these are the points that are stimulating. But this is also for assessment. Like if somebody has a pimple there or a red spot or a dot or something looks different in that area. A lot. Okay. Okay. This is called an ear chart, but I'll send you one example of one. I'll try to find one that's good. Okay, but in general, there's a couple of things we're going to look at with the ears for us. What are we looking at? What kind of things are we going to see in the ear? In general, what do the ears mean? Out of the kidneys. Yes. So what kinds of things can we see in the ears? Well, first we might want to ask people like, are you having like ringing in the ears? Are you having wax in the ears? Are you having itching in there? Like all these things could be related to the kidneys, right? But what kind of problems can we see really easily in the ear? So color patterns are going to show up. What are the colors of the ears going to mean?
Same thing than else.
It's pretty similar, yeah. So if the ears are bluish, right, that's going to be for circulation again with coldness. If the ears are purplish, right, and you can look at people's ears, they are different color tones, right? Purplish ears are going to be again for circulation with heat, right? When people are anemic, their ears are going to look more pale too and whitish, right? Okay. We don't have rebounding in the ears as there's not really many blood vessels, right? It's more cartilage and stuff. So we can't really like rebound and check that. But in general, there's a couple things that show up really prominently, right? So we have on the lobes are the most interesting part of the ear. So in general, this is very accurate. I can't draw an ear very well, but okay, so this lobe, I can't draw very good, but you can see this lobe here. The bigger the lobes, what does that mean? Good or bad? Good, right? Remember, if we look at pictures in Asia of Buddha, the earlobes are what? Really long, sometimes all the way down to the ground. What does this mean, though? The lobes are controlled by the kidneys. So when we see the Buddha like with really big earlobes, it means it's like filled with like energy and vitality and chi from all that wisdom, right? So the bigger the earlobes, almost all the time, the better. When people have no earlobes, like they barely even have a lobe, right? That means the again, the kidneys, adrenals, hormones are very depleted, just like the luna of the nail. It's also, in my experience, 100% accurate. People that have longevity often have bigger earlobes. Okay, or when you're genetically disposed to it. So it's a measure of longevity, it's a measure of really good jing, it's a measure of kidney and adrenal health, the bigger the ears are. Up until what point does that change? Yeah, Google is artificial intelligence and everything here. At what point does that change? Read and Google some of this stuff. Nope. Oh, Chat GPT is not good enough with the herbal medicine.
When you started to get creases and that meant that was it.
We'll get into the creases, yeah. This is just the earlobe itself. I can't find it, darn it. When you see this on someone, it's just like so clear. It's like, whoa. So the earlobes will eventually, they can, and some people get really puffy or look really fatty. This is where they're not a normal earlobe. This is where the earlobe gets really enlarged and puffy and fatty. This is like one of the most important warning signs, right? It's very easy to spot. I don't think anybody in this room probably has it. See, look at this. So you don't have it, but Noreen has this. She has a very small earlobe. You see that? That's like very small. But she also has, yeah. But she's rejuvenated her adrenals and her kidneys. She did a great job. And also she doesn't have all the luna hasn't came back yet, but her body has, but she had depleted herself so much that it's growing back though. But that's called like a small lobe, where somebody have longevity in the family. So, okay, come on up. Somebody's got really puffy earlobes here. Okay, so. But she has shown this side. She has we'll get into the cracks, but that's just what a crack looks like. And the earlobe, we'll get into that next, so you want to show them too.
I gotcha. Thank you, Dad.
Are the ears usually even right? Or is that-
They're usually not.
They're okay.
Good.
That's a crash.
Right.
Yeah, do you want a picture?
Thank you.
So that's what we call crack, but we'll get into that.
Kind of right.
So Linda.
Thanks.
So Linda, this is. If you see, her lobes are not how they're more puffy though and swollen. This is what we're talking about. This is like the beginning stages, but this is still not very intense. Like they'll get like really swollen and puffy. But this is, you notice how it's puffier and thicker, like it's starting to plump up a little bit.
Mhm.
Yeah. And also notice, look how she's starting to get the purplish and the red here.
And
So-
that means what?
So we never want to see swollen, and write this in your notes, you never want to see puffy, red, purplish earlobes. That's like a sign of imminent like heart attack and heart disease.
Start
So
with-
she is reversing it out though. I've been watching it for a while. I haven't told her at all. But she's getting better. But they were puffier. So when the ears are puffy, number one, it means either the cholesterol is like sky high. Like with people that have, like cholesterol that's normally in the 300s or 400s. Or there's like a blockage in all the blood vessels and heart. And the bigger the blockage, like the more puffy the earlobes get. And then eventually after that, when the blood starts to get blocked, they'll get more purplish. So she's reversing it out. Good job. Yeah. But see how you're just starting to get, I'll have you show the glasses, a little purplish. And then she has the crack here. This is the crack of heart disease too. So, but it's also growing out. It was bigger. She didn't know that.
Yeah, one more time,
But when
Nicholas.
it goes, this is the crack of heart disease. So when the crack goes all the way through the ear, that means it's more severe.
Yeah.
And it used to be with her, now it's shrinking, it's going away. Okay. I'll show the other class, other side. Okay, so you see that, how this crack, there's 3 cracks in the ear. This is the heart disease one. How it stops right there. That's from the piercing, but that's the crack.
Is piercing like bad, or do we do hurt? Do we
I mean,
hurt
it's
kidneys?
usually
Do we
bad.
prefer?
Yeah, it's just not the best. So. what are you gonna do, right? See how puffy it is, like it's more puffy here and there, almost like the ear is splitting. But it was worse, and now it's like going away. And so the deeper this gets and the longer it goes through the ear, the more intense, right? Yeah, my dad had a mortician friend who was really morbid. And at the bar, he used to look at everybody's earlobes, and if they were cracked, he would literally say, like, I'm gonna see you. But it's true. I mean, it's pretty, you're reversing it out, so good
Good
job.
job, Linda. Thank you.
Okay, so you see what I mean? So when the earlobes are purplish, the more purplish they get, the more red they get. The more serious it is. It's also, the purple is a sign of like fire in the heart. So we will see this in severe cholesterol, severe heart disease where there's blockages. And there's one other area we see it is in mental illness. Like people that are schizophrenic and bipolar will have this. I used to see this one guy, it was one of the wildest people I've ever seen. He was so, what we call heart fire. Would come in, he talked just like this. And he just was like, just ha ha, just like always laughing, like when the heart's in balance. And his earlobes were like the biggest, I have a picture of it.
Like
somewhere.
cauliflower ear?
Like the biggest purplest fatty like earlobes I've ever seen. But it's also a sign the heart like emotionally is just beyond blocked. It's just like traumatized, blocked everything. I mean, like in an hour session, I would even be able to say like, how's, I just did not get a word in. It was that excessive of heart energy.
So then that's kind of my question, because recently, the only doctor I've got that I really think really listens to me is my cardiologist.
Yeah.
And he says I'm doing fine. My good cholesterol was up a little bit just recently, but nothing worrisome. I do have PCOS, so my triglycerides are always high, but I take medication. And I just had this CT scan. It says I have 0 LC. And so my heart's like the one thing I think is doing okay, but then you said the emotional heart, so
Yeah.
is this necessarily physical or emotional?
I
Or is
think
it
it's-
all physical?
I mean, if you don't mind me saying in class, I think it's a
Say what
little
it is.
both.
Mhm.
I think it's a little both. But it's getting better.
It can be either or, it's not.
It
just
can be
physical.
either or, yeah, it doesn't have to be just physical.
Okay,
It's more, usually when we see this, it's usually physical. The emotional one is usually like when people have schizophrenia and stuff like that, that are really extreme. You know? Okay, so she has. There's 3 cracks, but we only really need to know 2. She has the crack going right down what we call the heart channel. There is another crack going a little bit more to the inside. This is the hypertension crack. So when people have genetically prone to severe hypertension, they'll have this crack going here. So again, if this is the earlobe, right? As this heals, right, this crack is going to not go through the whole earlobe, like gonna start growing back, like hers is halfway grown out. It was all the way through, she didn't notice. It was all the way through, but now it's about halfway reversed. Okay, and then eventually it's gonna be totally gone, right?
all this time I thought my ears were all getting funky and bent because I was fat. I mean, it didn't used to be this way.
Yeah. Yeah.
I just thought it
Yes.
was-
So everybody get that one? So the hypertension groove is a little more into the side. There's another groove, yeah. This actually groove is actually medically considered accurate also. Like Western medicine has found this to be like 98% accurate. Like heart disease and like severe cholesterol and that. Okay,
What's the third one? Are you gonna tell us?
it comes through here and I've never really found it to be as accurate or correlated. It's another heart indicator, but these are the only 2 that seem really accurate. There's another indicator that I found myself in the last 10 years that's really accurate. When in the earlobe, when you see an X. Now, it's not gonna be like so dramatic, like, whoa, there's an X in your ear, but there'll be 2 cracks going across like this. Guess what that is? It is pre-diabetes and the beginning of type 2 diabetes. Also mismanaged. So as diabetes gets better, this actual crack will get better as people's blood sugars resolve. I don't know why that works. I just stumbled on that by accident.
So pre-diabetes or.
Pre-diabetes, or they're already type 2 diabetes and don't know it often. Yeah. But as people get better too, as their blood sugars improve, that will go away. Remember, we can heal, right? We can heal these things. Okay. So this is why, and martial arts and in Tai Chi, we warm up, we pluck our ear, right? Because you're stimulating all those organs and meridians, right? By doing, remember when we warmed up, we do the ear plucks. Pluck your ear, right? This is also want to know something funny? It's like maybe a little bit off topic, but interesting. So the bigger the earlobes, the more longevity, the bigger the
Mhm.
kidney like power, right? That is also though, like the lips, the bigger the earlobe, that means people are more, they're born with more jing, which usually means their libido is usually like sky high. So if you're on the dating scene, waiting your partner, right? And that's important to you. That's like something you would maybe look for, right? This is also why, I mean, this is probably funny but true, but this is also why. But like kissing people's earlobes or, you know, it actually stimulates that part of your body too, that's acupressure. So that's why, like, a lot of people do that, right? And people who maybe are like a little, how would we say that, into other things, right? Like, would they like pain, that's what they're trying to stimulate, they're trying to stimulate their kidneys, right? So all these things make sense once you understand why, right? Why? So, okay. Okay. Those are the only things that I know about the ears. But I do know, like with charts, you can look at if anything weird on the ear pops up, you can chart it out and see what it relates to. This ridge right around the ear, like this ridge right here. This ridge right here is like the spine, so you'll see it like scoliosis and spinal problem. The ridge of the ear, this kind of like part that's kind of bony that I drew right here, is like the spinal cord itself. So yeah, one of my first IG teacher was really into ear therapy. He wasn't an acupuncturist, but he knew acupressure. And every time I was in pain, I dreaded asking him for help because he would take car keys and like till I felt like I was going to like this, I could not stand it. I mean, instantly cured it, but it was like the treatment itself was hard to bear. You'd start breaking out in a whole body sweat. It was like really intense. But you could do other ear seeding, right? Things like that. Okay, earlobe. Okay. Lack of hearing, right? Loss of hearing, those are all kicking into gears, right? Okay. Eyes. Let's do eye and eye kind of cavity area, right? Okay. We're gonna divide the eye up like this too. Okay. Let's see if I forgot anything in here. Face is really complicated. Want to hear Eli Jones quote? I can always tell a patient's condition, whether he is improving under my treatment, by looking at his eyes as soon as he comes into my office. Yeah. Okay. What do we know about the eyes in general? There's all kinds of different charts for the eyes too, right? You have iridology, which is like a Western study of the eye. But in Chinese medicine, it's just kind of like a little bit more simple. So this is the eye, right? And this is the area around the eye. Like here's the lashes. Okay. Not an artist. Okay, so just to review, what is the area below the eye? Maybe we should save that for the face.
I was gonna say six faces.
Yeah. Okay, there's a couple of ways to do this. There's like different Chinese charts where the whole eye is divided out and all the different organs. So like sometimes if you see a weird spot or coloration, you can kind of cross-reference that. But in general, the white of the eye is going to be the liver or the large intestine. Okay. And in general, this is the kind of top of the body. So this would be, it's not exact, but this would be like the top of the head, and this here is the pelvic floor. So the bottom of the eye is the pelvic floor. What this means in general is that if we divided the eye this way, this is your lower body. From your heart down, this is your upper body from the heart up. Okay, in general. So the main thing that we need to remember is that all the white parts of the eye are related to the liver and large intestine. So when we look into the eyes, just looking by how red somebody's eyes are, or how many vessels,
Oh, my God.
or how many blood vessels we see, right? Is going to tell us exactly how much heat or irritation there is, right? So, but then people always ask, well, I just have allergies, right? Well, what do we say to that?
Sure.
We say, yes, you have allergies because your liver and intestines are so hot, right? That's why you have it. You're having allergy symptoms because of that. This inner part of the eye, these two parts are controlled by the kidney and adrenal. Okay.
People,
Yeah, we're gonna call it the people. But the whites are the liver and large intestine, the pupil is gonna be the kidneys, adrenals. This is why, like, when you're in fight or flight, you can just look at the eyes, and when the pupils are dilated, right, you know, the kidneys are in like stress mode. So we can look at people's eyes in general and just see how stressed they are by their pupils. Right? If your pupils are really dilated and contracted, you have that animal eye, right? You know you're in stress. And if somebody says, yeah, I feel pretty calm, and their pupils look like that, what does that mean? Like, they're probably beyond fight or flight, or they're so fried and fatigued and wired, tired and wired, you know, that they're just beyond that, and they're just always in fight or flight.
so those people who just always have huge pupils or like always in fire cold.
Usually, yeah.
The big symbols are or little ones.
They'll be more, yeah, they're more contracted, not, I guess, large, they're like more, like contracted. Not the pupils get, as they get more stressed, they get more like contracted and small,
I mean, I just know people who just like have large pupils all the time,
yeah.
and that means. They want to.
If they're dilated,
What's that?
she's asking if they're dilated all the time.
If they're dilated, it could be a stress, the opposite stress response too, but usually the extreme fight or flight that we're talking about, like if somebody just had like a trauma happen to them, the pupils are like just contracted and just beating. Right? But all of this here is going to tell us how bad digestion is, how bad the liver is. The more red it is, the more intense it is, right? When we see more blood vessels, here we're looking at blood vessels, right? When we see more blood vessels on the lower part of the body, right? We know there's more inflammation in the lower part. If it's more in the upper part, it's more. Okay, so when we have the eye, I should.
Would that go the same for like left versus right? So, I mean, I keep having where when I go and do very strenuous exercise, my left eye gets all bloodshot, but my right eye looks fine
Yeah,
every time.
that's left eye, especially liver.
Yeah.
Yeah. So the eye, we usually see blood vessels going up, maybe like a little bit across. Those are more normal. Okay. The blood vessels we don't want to see are going this way. Okay. So it's normal to have like some little blood vessels, but the more intense they are, the worse. But again, like the nail, when we see blood vessels going across the eye horizontally, that's like a bigger warning sign. Okay? In fact, one of my teachers, Dr. Chen, that I studied with, like the great diagnosis master, he said, when a blood vessel goes all the way across the eye, it's like a cancer indicator. It's a cancer indicator, even before people would know they have it. Fairly accurate, up to a point it was always accurate, and lately it doesn't seem like it's always accurate, but it's helpful.
So if it's not only, I would use that word for default.
Just bigger inflammation, bigger stress, bigger trauma. Yeah, it's not as specific as like the nail that I have found. I'm sure somebody probably knows exactly why that would happen. Okay, also, we have what I call the rain of fire. This is just my own insight. So on the eye, we can have three. I call it raining down or raining up. We don't like to see what I call the three lines raining down from the top part of the eye towards the middle or the bottom part. So typically when people have like kidney, bladder, ovarian, uterine cancer, they'll have these on the bottom part of the eye. And when they have a cancer in the upper body, like breast, neck, head, brain, they'll have these three lines. This is not 100% accurate, okay? But it is something I see with almost every cancer patient. But I call this fire raining down. It means there's uncontrolled inflammation that's not being checked. So it's not exactly that perfect, but they will look like three all in a row, like all lined up together. So this is if you see this, you just want to be more cautious with people and make sure, you know, if they're having any kind of weird symptoms, that they're maybe getting checkups and stuff. Okay. Okay. So also the color of the eye is going to reflect what? What if the color is yellowish? Same pattern, right? Liver. Okay. So the yellow eye is going to be more liver. Okay. What we're looking for in the eye is what we call the shen or the shine. So one of the greats, when we assess people, we're always looking for these positive traits that mean extreme health or extreme likelihood of health. And they say when we look at the eye, ideally we should see the shen or the spirit or the shine. You ever see people who are like really inspired? They have like that shininess about their eye, or like when motivational speakers, or you just see it sometimes when people are like radiantly healthy. There's just like this sparkle in the eye. You can see it right away. So as patients like develop that, that's an awesome sign that yeah, they're like their body is recovered enough where now they're getting the shine back. Or in people might be just so emotionally, spiritually balanced that they'll get this shine too. Like a lot of spiritual teachers that are really joyful will have that. So this is one of the great, like one of the 5 great prognosis. We want to see shen or like spirit in the eye. And usually for this to happen, the eye has to be pretty clear, like the whites will be really clear. You know, it's normal to have some blood vessels, but we're not going to see like a ton of blood vessels. Okay. What else about the eye? Okay, what about the area under the eye, like the eyelids, right? What's that? What's that? What'd you say?
I said wrinkly, I just put a picture of my eye.
So this area under the eye, remember, is controlled by the kidney. So in general, when we see dark under the eyes, or we see discoloration, or the eyes are sunken, or what a lot of Americans would call bags, right, under the eyes. That's a sign of one of two things. More likely, it's gonna be kidney adrenal Jing. Right, so as our kidneys restore, as our adrenals restore, as our Jing restores, the under the eyes will become less wrinkly, less saggy, less puffy, less dark, right? Here, we're mostly talking about, we're gonna see darkness under the eye, right? It can also mean we have a large intestine food allergy. So sometimes food allergies will have dark under the eyes only. Okay, sometimes it almost looks like it's dirty or like slightly dark, right? So the darker this gets, the worse, right? The more the adrenal fatigue. It could get to where people almost have like, almost like blackish, bluish under their eyes, right? So that's a really good, simple indicator. We can also see under the eye, sometimes they'll get really puffy, where they'll actually puff up. What does that mean? It usually means the kidneys are so weak that they're just like there's water being retained throughout the body. So it's still like kind of a kidney adrenal indicator, but we see that a lot in like people that have actual kidney disease, where they can't manage their fluids or they're getting dialysis. They'll get really like puffy, almost where they can puff out even like beyond the eye sometimes.
So I was always told that the color under the eyes meant you had too much sugar in your diet, so that's false.
I mean, it could just be that it's just some like digestive stress, but more that the sugar is probably like affecting your adrenals. Or the other things you're eating with the sugar, you know, probably if you're eating a lot of sugar, you're probably eating other things that are not so good. You know. What about above the eye? So this is one of the most important things to know with the eye. Below the eye, this is so accurate, by the way, this is like 100% accurate. Under the eye, always the kidney, sometimes the food allergy. What if it's the whole eye is dark? Upper eyelids and lower eyelids. That becomes totally different. Now we're talking about the spleen and stomach. Now we have a absolutely clear spleen, stomach assimilation issue. And it's very accurate. Like all the patients I know with malabsorption have this like dirty color all around their eye, top and bottom, not just under, the whole thing. Yeah.
Comment specifically in your inner corner.
So the inner, so in Chinese medicine, there's like another eye chart where there's like the 5 elements in the eye. The inner corner is the liver. So this, yeah, the inner corner is the liver. Yeah, I'll try to send you a picture of another eye chart that has that. I don't know if this one, oh yeah, this has it. Like all these different charts, so. I have this awesome chart, but I can't read it, and the drawings are so bad, I can't totally tell all of them. It's like the greatest set of charts I've ever seen. Pastor Chen found these at an antique shop in like China, and they're like ancient, and copy them and photocopy them, but I can't really read most of it, but it's really cool. Okay. So if it's the spleen, stomach, digestion, and assimilation, it's the whole eye. Or if there's actually like a disease of the spleen where your spleen is swollen and your lymph is swollen, it's going to be all around the eye like that. Sometimes it'll be puffy too. Okay. 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 What if the eyes are bugging out? Right, they're pressed out, right, where they're bugged out. That's really easy to spot, right? Hyperthyroid, you know, It sounds like, we read in a book, you're like, oh, okay, maybe this person's eyes are bugged out. But then when you see it, oh, yeah, this is very easy to spot, very easy to spot. When we see that, we want to refer someone for a thyroid test, right? Okay,
Was there something specific physical above the eye?
What's that?
Was there something specific physically above eye?
I don't know anything, I've only know that like when it's, yeah, I don't know anything about just above, yeah.
What are high cholesterol indicators in the eye?
But when you have severe cholesterol in the eye, up here in this upper part, you'll get little lipomas. Like these little fatty little deposits that look like little bumps.
Like on the eyelid.
Yeah, on the eyelid. That usually means like the people that have like, this would be severely high cholesterol, like 3, 4, 5, 600. That some people just genetically have. And that's just literally the spleen, like the lymph, like all the fats are really spilling out.
On the inside.
Just anywhere above or around the top of the lid. Yeah. You have one? Let's see.
I can't remember which eye it's on them. It's really small.
Not too bad though. I don't see anything like dramatic.
Used to be like red ones.
I mean, maybe this, not really dramatic though.
Okay.
Not too bad. Okay, so in general, Eli Jones tells us too that just as the eye gets more clear, it means like disease is weak. Like as there's less blood vessel, that is less red. So even if we don't know every little blood vessel, just in general, you can see as people are trending in the right direction.
Do the eye take a while to heal up like the nails do, or are they quicker?
Eyes are quicker. Yeah, nails are really slow just because of how they grow. The eyes can be quicker. Ooh. Again, with eyes, we're looking for that clear eye, that bright expression. That would be like a healthy person, right? Glue eyes, what would a glue eye be? Like when your eyes are really gluey and sticky in the morning. 100% liver, right? That's a liver secretion. Okay.
What is, when we create, I don't know, I always call it sleep, like the little crusties that you get in the morning, what are those things?
That's liver.
Eye boogers.
Yeah, all that's liver secretion.
Why do we wake up with puffy eyes? If some people wake up in the morning, their eyes are all puffy, but that goes away.
A lot of that's just the kidneys and that.
What about those yellow? I used to have really big yellow blobs like right in here, and they call it something.
That's liver.
Liver.
Yeah.
I'm trying to look it up.
That's about all that I know about the eye. I mean, that's all that I have really found to be, when we get into specific medicine, there's just like all kinds of weird. Like if the eyes have this trait that we like this, or we'll talk about that eventually too. But that's about all I know assessment wise with the eye. It's very accurate. It's very easy, right? So far, everything we did today is like very easy to do, right? So maybe in class, Wednesday, we have to do the lips, the face, the hair, and then we'll start working our way through the lymph glands and all that. Okay.
So
Yeah.
when the, big thing now to get the earrings, things that stretch the earrings.
Yeah.
That.
It's all just stimulating, it's all these gauges and stuff, right?
So they could go big, where their earlobes are hanging down and
Yeah.
a big hole in it, is that.
So like, yeah, in my experience, people that want the big gauges and stretch lobes like that, they're just trying to stimulate like hidden part of the body. Help them overcome fear or something like that, so. All right, so next week in class, we're just gonna resume physical assessment. Okay. Thanks. Yeah. You.
Yeah. I don't.